plastic surgery questions answered by Dr. Luis Viñas.
Mommy makeover is a term that started a few years ago, maybe 10 years ago. And it came up because most women, after having children, they all want to be the way they used to be, and maybe even better. They got married looking great, they were young, they started having children. The body changes after having children. Even if you take good care of yourself, you're gonna change. Having a baby changes the way the fat distributes through the body. It changes the way the breast looks afterwards, after breastfeeding, and even the abdomen from stretching 2, 3, 4 times, depending how many children you have, is gonna change the way it looks. The other thing is that the muscles on the abdomen change. By stretching so many times, the space between both rectus muscles, which everybody likes to be nice and tight, they separate. There's nothing you can do to put them together. Now, where we come in is the patient comes in and they want to look the way they looked before, and right away the first question is, do you want to enhance your breast? Do you want to improve your abdomen? And if the question is just for both, then you're having a mommy makeover. Mommy makeover usually takes care of the breast, the abdomen, and usually some liposuction to contour the side of the waistline so they get that hourglass figure again. Lately, in the last couple of years, we started doing a lot more fat injections to the buttocks. A lot of people know that as Brazilian butt lift. And what that means is that with the liposuction portion that we do to shape the side of the patient, we can take that fat, cleanse it, and inject it back into the patient. The most popular place for injection is the buttocks. That way they can have now a nice curve and they can have a nice round bottom. Now, the other place that we're injecting fat, which is also becoming very popular, is on the breast. So many mothers don't want to have an implant. They just want to enhance the size a little bit. So if you have proper amount of fat, you can inject it on the breast, and it's completely adequate and approved by all the plastic surgeons, something that is being done very often with no negative sequelae. So we're doing a lot of that as well, or combination of all those procedures. So mommy makeover is very popular, especially in Florida. It's something that I do a lot of, and the recovery tends to be nice and short if you do it properly, if you have the proper techniques, which experience taught me how to do them. And what I do in my case is I use a lot of the harmonic scalpel, for example. I also use what we call fluid, injection of fluid in the area of the abdomen and the area of the liposuction, the area of the breast. By injecting that fluid together with the harmonic scalpel, which is ultrasound, the results are even better because the patient can recover in a shorter amount of time. So it's not just doing the procedure, it's how quick I can get the mother back to her normal, which usually in 2 weeks or 3 weeks, they can after a mommy makeover.
Contact Dr. Viñas today to schedule your free consultation.